Dave, good morning.
Good morning, Neil. How are you?
So here we are, still women giving birth and having to do much of it on their own because of COVID restrictions. Although other parts of the country have changed the policy. What's your own situation?
Yeah, I suppose my own situation, Neil, is my wife is due in for an elective section this week. I suppose all the visits up until now has been by herself. Which,
yeah.
Look, I'm happy to go with that. I suppose the big visit really is the 22-week scan, the anomaly scan, and some of the hospitals, I suppose, across the country did allow partners in for this because it can be quite a stressful time, I suppose, as you know.
Yeah.
CUMH was one that didn't, I suppose, facilitate partners at any stage during the last 12 months. So I suppose we've seen over the last number of weeks there, the CUMH, the National Maternity Hospital, the Rotunda, a number of other hospitals have started to allow partners back in for the 22-week scan and also visiting on a daily basis after the birth. CUMH...
So, forgive me, are there any visits after the birth in the CUMH?
No, there's not, Neil. Nothing at all.
Okay.
So what they are allowing, I suppose, is from when your partner either goes into active, I suppose, labour, or if they're going in for a section, the partner is allowed to come in at that time, and as soon as the baby is born, they're allowed to stay in that recovery ward for. I suppose I spoke to a number of parents up to maybe a maximum of 2 hours, but it depends how fast that.
So you're in for the labour and 2 hours after.
At a max, yes, and
okay.
Then they're moved back to the maternity ward where you're not allowed to visit, and on the day of their discharge, depending on how long that is, they will be brought down to the door by a nurse and you will meet them at the door. You're not allowed onto the maternity ward at all.
Now, do you find this more upsetting, or is it your wife finds it more upsetting?
I think, Neil, we're going to the stage where I'm finding it more upsetting at this stage. But no, look, absolutely, my wife would love to have the support, and I've spoken to a number of different women through different Facebook groups at this stage, and they're all the same at this stage. They just want to have their partners there. I suppose they see that it's quite unfair that a number of the bigger hospitals throughout the country are allowing partners back in. And I just had a look at the statistics last night in relation to, I suppose, the COVID rate for those areas, and they're off the wall compared to what we have in I suppose, the electoral area for CUMH, which is currently 184 people per 100,000, whereas we look at the Rotunda.
Yeah, I suppose they want to keep it. They want to keep it that way, though, don't they?
Yeah, but the Rotunda is 556 people, per 100,000, which is three times what we have here in Cork, and yet the same. I won't say the same consultants, but consultants up there who also want the best for their patients are allowing partners back in. Like when you look at the World Health Organization, Neil, back in February 2018. They brought out guidelines, I suppose, together existing and new recommendations that address not only the clinical requirements for safe labour and childbirth, but also the psychological and emotional needs of women. These are totally disregarded at this stage, Neil, because, it's
more so than families who can't visit or be in the same room as an elderly parent, for instance, in a nursing home, do you think?
I suppose I have that scenario myself where my mother-in-law goes down and she sits outside a window in a nursing home down in Kinsale, and she gets to wave into her mum, and she's been doing this for the last 12 months on and off. And look, I'm not looking for one rule for one and one for the others, but that's currently what's happening within the country with partners being allowed to visit up in Dublin and they're not here in Cork.
And are you like to be there, or you're worried that something could go wrong and you'd want to be there for that, or your wife would be anxious without you, kind of thing?
I think it's just a bit of both, Neil. I suppose, I have engaged, with some of the Facebook groups just to see what anxieties levels are out there. And, I had one woman message me privately saying that she was breastfeeding and that she had her baby, in her arms, and she was falling asleep there and then. And she was a nervous wreck over it because she didn't have her partner there to support her, just that added bit of assistance. There was one woman that was refusing to put her baby back into the cot because she was having to call the nurses, and there was a faulty buzzer that, it wasn't the nurse's fault by any means, but she just felt that the baby, when she was needing a feed, that it was taking longer to get to the baby because she had a section. And these are something that a partner can help out with, and obviously there's an added stress on the nurses because they're pushed to their limits as it is.
Yeah, and I suppose they're following guidelines, you see, and it must be very exasperating and upsetting for them to, there seems to be different protocols. I was sent a photograph last week. This is a fairly graphic photograph of at least three family members in a Cork hospital. taking selfies with their father who had passed away in the bed. I mean, you find that hard to believe, I know, but it's true. How can that be allowed to happen? And you can't go into a birth.
Yeah, look, I don't know, Neil. I suppose, some people will push the boundaries. And look, I'm not one for that either, Obviously, there's rules in place and I'm happy to adhere to them.
No, but you wouldn't be able to get through the door. Like, how did they get through the door?
I have no idea, Neil, It depends, I suppose, on their mentality as to how they got in there. But look, they managed it. And look, it's not fair on others that were in wards, with similar issues. And that is the problem at the moment, is that there is one rule for one and one for the others,
Okay, I think Holly Cairns, the Social Democrats TD down west, is across this story and has been campaigning for change for a long time now. So I put in a call to her this morning to see if she can update or enlighten us as to whether the CUMH is going to change. Holly, good morning.
Good morning, Neil. How are you?
I'm well, thanks for taking the call, because Dave has talked there about the National Maternity Hospital, the Rotunda and the CUMH are all allowing partners in, but the CUMH seems to be rogue on this. Why is that?
Yeah, this has been an ongoing issue for almost a year now. So, around the first lockdown, I remember it sort of transpired that it was essentially a postcode lottery. And Dave spoke there about, how in some hospitals you can go in for the so-called active labour part of the birth. But, I've spoken to so many women who could have been in labour for 24 hours alone before that part of the birth starts. So it's really not, women are really alone for this part of the birth.
Oh, I see. I thought it was the whole labour. It's just the actual delivery part of the labour.
Absolutely. So you could be in labour for a very long time, depending on how your birth goes, before you have your partner with you for the so-called active labour part of it. But I've raised this repeatedly in the Dáil with both the Taoiseach, the Minister for Health, the Junior Minister for Health, because there's so many aspects to it. Not only is it hard to go through childbirth alone, especially for new mums, they get in touch a lot, but it's even harder when people get tragic news. And there's also the issue of parents being considered as visitors. You're absolutely not a visitor at the birth of your own child. I don't think Dave is a visitor in the hospital when his partner is giving birth. And the current visiting practices in maternity services document still refers to parents as visitors. So it says in the document that the step of restricting visitors and individuals accompanying women to their appointments was implemented as part of a suite of actions taken by maternity services to ensure that essential care to women and their babies continued, and that the risk of well-being was kept to an absolute minimum. And so that was when they allowed partners to come in for anomaly scans. But I think we can all agree, with the document, in that women, the health of women and their children is a priority. But women and their partners who are campaigning for a review of the restrictions obviously agree with that. That is, what everybody agrees on. But time and time again, we've seen, when we've come out of different lockdowns, and of course it looks like this one will be going a different way, but we saw restrictions across society being reviewed, revised and eased. Like, you could go to the pub, you could go to a wedding with so many other people, but you still couldn't attend the birth of your own child. So it's almost like this has just been consistently ignored. And that became clear to me when I was asking for information. I did a meeting with the Cork and Kerry HSC regional group about this. Like I said, I asked the Taoiseach, I asked the Minister for Health and the Junior Minister for Health, and I got a different response from all of them. So I remember the Taoiseach saying there should be a national strategy. Every hospital should have the same rules implemented. The Junior Minister for Health saying this has to be done on an individual hospital basis, depending on...
But the numbers in CUMH per 100,000 are lower than the ones that allow partners in.
Yeah, and I think, all of the restrictions are based on, a certain amount of risk assessment. But for example, Dave and his partner there, if Dave drives his partner to the hospital, she gets out of the car and goes into the hospital, and Dave has to wait on his own in the car. Like, Dave has already been a close contact, so the risk, I think that needs to be taken into consideration, needs to be taken